Hi there, in this video, I'm going to show you some simple home remedies that you can use to pain an anus. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Many disorders, including hemorrhoids and anal fissures, cause anal irritation and discomfort. Fortunately, there are simple methods for relieving anal discomfort. The anus is the lower intestine's exterior aperture. Fecal material accumulates in the rectum and exits the body through the anal orifice. If your intestines are bothering you, you may also be feeling anal discomfort. Anal itch, soreness, tenderness, and overall anal discomfort can be caused by a variety of intestinal health concerns. Here are some frequent issues that may have you looking for help. The anal fissure. This is a tiny rip in the anus' thin exterior skin, which can be quite painful despite its modest size. Anal fissures are frequently produced by the passage of very hard feces, although they can also be caused by the discomfort of severe diarrhea. Hemorrhoids. Hemorrhoids appear in a variety of forms, but they always start the same way. A vein in the anus or rectum gets severely engorged with blood and enlarged. This is usually caused by straining to have a bowel movement, which is commonly caused by constipation. Diarrhea. Irritation and anal pain can be caused by frequent passage of watery stool and frequent wiping of the area. Constipation. This is characterized by hard, infrequent, or difficult to pass feces that might produce anal pain even if no fissure or hemorrhage occurs. Diarrhea and constipation treatment. If you are experiencing anal discomfort as a result of diarrhea or constipation, treating those problems will help alleviate anal itch or pain. Consult your doctor about dietary changes, dietary supplements, or a drug trial. Fiber supplements can be useful and can be used every day, says Arun Swaminat, MD, head of the Inflammatory Bowel Disease Program at Lenox Hill Hospital in New York City. However, I don't recommend taking more than the recommended quantity, as this can induce bloating in some people. You might also want to try medications to treat diarrhea. Increasing fiber intake with whole grains and additional veggies and fruits. Anal discomfort relief. There are various steps you can do to fast relieve anal discomfort. Consider the following suggestions. Maintain a clean environment. It's critical to keep the anus clean of any feces, but avoid using soaps that might irritate sensitive skin even more. Warm water can be really beneficial. When the anus is itchy, try having a sitz bath, which involves sitting in a shallow tub of warm water for 15 minutes several times a day. Allow the area to dry naturally or dab gently with a clean towel rather than rubbing. Apply a barrier cream or ointment to the affected area. Using a cream barrier to protect your delicate, irritated skin from feces will help relieve anal discomfort and irritation. A prescription cream or an over-the-counter ointment may be recommended by your doctor. Dust it with powder. To keep the region pleasant, apply a light dusting of cornstarch or unmedicated talcum powder. Allow some fresh air in. Moisture can aggravate the thin skin of the anal region. Wearing loose-fitting clothing and cotton underwear allows air to circulate, which can be beneficial. Do not use dry toilet tissue. Instead, use a damp towelette that glides along the skin without pulling. Make sure it doesn't include alcohol, which is drying and can irritate the skin even more. Use a numbing medication to relieve pain. Rubbing in a witch hazel lotion or ointment can numb severe hemorrhoids and relieve anal discomfort, while hydrocortisone creams help cure anal itch. However, before using these lotions, see your doctor. Avoid further injuries. If you're still straining to urinate as your hemorrhoids or anal fissures heal, you're definitely in a lot of agony. You also risk developing another hemorrhoid or reopening your anal fissure before it heals. Taking a stool softener can help with bowel motions while anal fissures and hemorrhoids heal. Use an ice pack. This will not only relieve anal discomfort, but it will also assist to relieve the uncomfortable swelling of hemorrhoids. Take an analgesic. Anal discomfort and pain can be managed with over-the-counter pain relievers such as ibuprofen or acetaminophen. These remedies can only provide temporary relief from anal discomfort, irritation, and pain. To properly address the source of your anal discomfort, you must first identify the source of the pain and resolve your digestive health condition. An anal fissure is a small rip in the mucosa, the delicate, moist tissue that lines the anus. An anal fissure might form when you pass large or hard feces during a bowel movement. Anal fissures can cause pain and bleeding during bowel movements. Anal fissures can affect people of any age, but they are most common in newborns. Most anal fissures improve with simple treatments such as sitz baths or increased fiber consumption. Anal fissure patients may require medication or surgery. This article focuses on home treatments for anal fissures. Home cures and natural medicines have few adverse effects and are widely available. This article provides a full description of anal fissure, including its causes, symptoms, and adverse effects. What exactly is an anal fissure? An anal fissure is a small rip in the mucosa, the delicate, moist tissue that lines the anus. An anal fissure might form when you pass large or hard feces during a bowel movement. Anal fissures can cause pain and bleeding during bowel movements. Your doctor will most likely ask about your medical history and perform a physical exam, which will include a mild examination of the anal region. The tear is frequently noticeable. This exam is usually all that is required to identify an anal fissure. A more recent, acute anal fissure appears like a fresh rip, similar to a paper cut. A deeper tear is expected in a long-lasting, also known as chronic, anal fissure. It may also have fleshy growths on the inside or outside. If a fissure lasts more than 8 weeks, it is called chronic. The location of the fissure provides information regarding its cause. A fissure on the anal opening side, rather than the back or front, is more likely to be an indication of another ailment, such as Crohn's disease. Your provider may advise you to undergo additional tests to determine whether you have an underlying condition.